Well, aloha and good morning. Thanks so much for tuning in. I'm Ryan Kalei-Suji, joined by Yanji Denise. And if you are a frequent watcher of this program, you'll notice my background looks a little bit different here today. I've actually just arrived in Columbus, Ohio, after traveling 12 hours over 6 different time zones. Just checked into my hotel room. I'm covering the University of Hawaii men's volleyball team and their quest for a national championship. We'll talk a little bit more about that at the end of the show, Yanji, but we want to get to a special guest that we have coming up.
That's right. We'd like to start many of our Mondays here with Governor David Ige, who is joining us live from his office at the state capitol. Governor, good morning.
Good morning. Thank you again, Yanji and Ryan, for giving me this opportunity.
Well, we love having you on, and we want to start with some questions that we've been getting already from our viewers on Instagram about the CDC guidance regarding mask mandates. You know, the CDC has changed its recommendation now, saying that those who are vaccinated, when they're outdoors, they don't necessarily need to wear a mask. What are your thoughts on that, and do you anticipate changing any of the statewide mask mandate rules?
Yes, thanks, Yanji, for that question. You know, when we looked at the CDC guidance, although it seems like it's a big change, it really isn't all that different from our current mask mandate. You know, our mandate requires people to wear their masks outside, except if they can maintain 6 feet of physical distancing. And so, I mean, I think it's just a perspective. When we looked at the changes, we didn't see all that great a change. It's just, I think, the perspective. And I know that there were other guidelines that dealt with vaccinated people indoors and things. And, you know, because we can't recognize who's been vaccinated and who hasn't, we thought that it would just be simpler to maintain the current mask mandate. And then we would change it, I think, as more and more people get vaccinated.
You know, Governor, one of the things that we also recognize is that this is a time where those who are 16 and over can get a vaccination shot. What has the response been like? We are hearing that there are less people now that are going out to these sites as we get more shots in arms overall. Are you concerned at all that there may be a point where people aren't necessarily lining up to be getting the vaccines, and it's going to be more of a marketing and PR campaign on the state's end to encourage people to do so?
Yeah, I do think that, Ryan, what we're seeing is that maybe those who are now eligible might not have been as motivated, or they've been waiting for a while and they don't see a sense of urgency. You know, we will continue to work, and we're beginning a new campaign to really encourage everyone to get vaccinated. You know, the more and the quicker we can get to herd immunity, the quicker we'll get back to the new normal. And that's what we continue to emphasize. You know, it has been a challenge, I think, as you know, the federal government has been really pushing so that all pharmacies are open. There are more and more locations now across the state for people to get vaccinated. And so, I mean, I think we will continue to advocate and encourage everyone to get vaccinated. The messaging is changing a little bit, but I'm still glad to see so many in our community want to get vaccinated.
You know, one of the big reasons that someone might want to get vaccinated is because it makes it that much easier to travel. Of course, on May 11th, inter-island, neighbor island travel will open to those with a verified vaccine. They'll be able to bypass some of those safe travel restrictions. When do you anticipate having that for Transpacific travel? I know, for instance, Ryan's in Columbus right now. For him to come back, he's got to get that test. When would that not be necessary?
Yeah, Yanji, the test will be with us for a while until we can get verification of those vaccinated in another state. As you know, and I've spoken on your program, we are working with a couple of vendors, Common Pass and Clear, and they are working. We're working with them now to get access to the state vaccination information so that we can verify within the state. And they are working with all the other states to get access so we can verify the vaccination record. So it will be a ways off, at least a couple weeks off, before we can get a verification of vaccinations done in other states. But I think that that's an important part of our program. And if we are able to verify vaccination status of those who got vaccinated in other states, then we would be able to reopen the Trans-Pacific travel.
But just to follow on that, why not allow that for local residents? Because obviously, if you can verify them inter-island, you could verify them for Trans-Pacific.
Yeah, so one of the nuances, Yanji, is that we can't discriminate against those who are residents in our community and those who are out of state. So we're kind of working on it. For example, Ryan, if he is vaccinated and completed the regimen, he would be in the safe travel system, and we would be able to recognize that he did get vaccinated. So we are working in that as best as we can. We are not able to say if you're a resident and vaccinated, you're able to travel without quarantine. And if you're a non-resident, even though you say you're vaccinated, if we can't verify, then we can't treat a resident different than somebody coming into the state.
On Friday, we had Mayor Blangiardi on this program, and we talked about the tier system and its purpose at this point in time as more people get vaccinated. And, you know, there seems to be changes that have been made to the tier system that you have granted approval of. And his thought is that, you know, there could be a time soon where he does away with the tier system and we kind of go back to what we started the pandemic with restrictions in place, but not necessarily having to these benchmarks of case counts leading us in this tier categories. What are your thoughts on doing away with the tier system and maybe moving back to what we started with before the tier system was put in place and just having some restrictions in place?
Yeah, Ryan, I do think that, you know, when we first developed the tier system, what we were hearing from the community is that they really wanted to be able to anticipate if we were going to be stricter or on the converse, as the case counts went down, when we would release restrictions. And so, you know, the tier system is modeled after the Johns Hopkins public health recommendations, and so it did serve the purpose at that time. You know, we did not know that we would have a vaccine, and if we can get as more and more people get vaccinated, it does impact the rate of transmissibility of the virus in our community, and it should change some of the policies. So, you know, we're kind of working through that. Right now, I am concerned because we've been really stuck at an elevated level. As you know, we've been averaging almost 100 cases and 80 to 90 cases over the last week, and it hasn't really come down, even though more people are vaccinated. So we continue to look at the data and try and make the best public health decisions that we can.
You know, the mayor's point was really that when the tier system was put into place, the vaccine wasn't part of the calculation. And so he expressed to us that it seems like it would be outdated because it's based on old models. Do you think the tier system still serves a purpose?
Yeah, I do, Yanji, and it's not so much old models as clearly it's designed to, you know, this virus is transmitted person to person as people interact. And the tier system was really trying to look at ways, if the virus activity is very high, then we want to really restrict interactions. If the virus activity is low, then we can allow more interactions in our community. So, you know, the basic public health still makes sense. The fact that people are vaccinated, those who are vaccinated are less likely to get ill and extremely less likely to infect others. And that's the difference, even though the notion of transmissibility is pretty much built into the tier system at the same time.
You know, you mentioned concern with those numbers hovering at about 100 consistently recently. And but when you look at the number of shots in arms that we've had with the vaccine, over 1 million shots have been administered to those who live in the state of Hawaii. You would think that as these vaccination numbers go up and more people get it, that our numbers would tend to decrease. But we're, again, holding steady at that 100 case count about daily. What do you attribute that to? And is that any concern, knowing that although we've done well with the vaccination process, our case numbers really have not changed all that much?
Yeah, Ryan, I think what we're seeing, and when you talk to the epidemiologists, is what we're seeing is more clusters of smaller groups. And what is happening is people are gathering and they are not certain what the status might be, and someone who is infected is in that gathering. So, we definitely are concerned. We want to just remind everybody that if we can stay focused in the next 4 weeks, it would make a tremendous difference in the spread of the virus. And the public health officials are really concerned because as people get infected who may be vaccinated, we could end up with a variant that is not the vaccine is not as effective as, and then we might be back right where we were 12 months ago with a very infectious virus and a vaccine that doesn't work against it. And that's why it's really important, and that's why we continue to keep the mask mandate in place. We ask people to maintain distance and limit interactions. If you know that the people you are having dinner with were vaccinated, or if the people that you're meeting with were vaccinated, then yes, you can interact without a mask. But other than that, you got to mask, maintain distance, and wash your hands and stay home if you're sick, because that's what spreads the virus.
What are your thoughts on not mask, but vaccine mandates? We're seeing more and more educational institutions across the country adopt vaccine mandates for students and faculty. We're told UH has been considering something similar. Would you ever anticipate a time where it might be a condition of employment for the state? We know that, certain hospitals, for instance, require a flu vaccine for all of their nurses and doctors. Could you see something like that happening at the state level? And just overall, what are your thoughts on vaccine mandates?
Yeah, I think, Yunji, we do, as you know, we do have a number of vaccine mandates when children start school, for example. So, I mean, vaccine mandates has been part of our community for many, many years. It really is about trying to mitigate the public health risk. And so, is that something that we would be considering? Yes, we'll consider it, depending, I think, on the sustaining and the virus activity that we see in the general population once we get to herd immunity. And part of that will be how effective the vaccine is long term, and whether, for another year or two, people will be protected against the COVID virus. Then we might not need to implement a vaccine mandate. It's like measles, right? We do require vaccines for the measles because we do know that children can get very sick if they're exposed, and it's a very contagious disease. So we'll be looking at any kind of mandate in the context of the public health requirement.
We, of course, like to bring in some of the viewer questions. We have a question from Amy that's asking specifically about what's happening in Kauai. She said numbers on Kauai are rising. Does the state have a plan for the future should those numbers rise further? What are your thoughts on what you're seeing on the island of Kauai and the conversations that you're having with Mayor Kawakami there?
Yeah, Ryan, we do have many conversations. We spoke a couple of times over the weekend. We are concerned. We are seeing virus clusters, both from travelers who have come to the islands and from residents who have traveled out of state and then come back. And we definitely are concerned. We are thinking about whether we need to replace restrictions in what's happening. We do believe at this point in time we have contained the clusters that have popped up. But that's the challenge, I think, with COVID-19. It doesn't take much to really ignite a number of cases in very close quarters. And that's why we encourage people to get vaccinated, because that's the best way to get back to a new normal where we don't have to worry about who we're meeting with, and don't have to worry about those who might travel out of state and might get infected with the virus.
We've talked a little bit about the change coming to safe travels when it comes to neighbor island travel. At one point, we had been talking about the possibility of lifting all the restrictions for inter-island travel. Is that still on the table, or are you keeping with the current system, given that you've added now the vaccine verification exemption?
Yeah, Yanji, I do think that as more people get vaccinated and we can get to that herd immunity, we would be able to release and allow more travel inter-island. I mean, I think that that's the next decision point. Until that point in time, in talking with the mayors, they still see a value in the mandatory quarantine for those traveling, especially if they haven't been tested and they haven't been vaccinated. So we will continue to have some restrictions in place as long as there's a public health purpose to do that.
I have to admit, this is the first time that I've traveled during the pandemic, so I had a chance to see how things operate at the airport. And one of the things that struck me the most was to see how many of workers are now involved in this process of helping people get off of the plane, directing them where to go, who has those tests, who doesn't, and now we're going to add in the vaccine verification station as well. Talk through that. I mean, how is the state able to afford the personnel that's involved with all these new entities and different procedures that now have to be in place? And what department does that fall under? And how is the state going to manage all these different scenarios? Because I imagine there are still people who are arriving in Hawaii who have not taken a COVID-19 test and have to go into quarantine. Are people still following up with those individuals as well? There just seems to be a lot of different scenarios now that the state has to plan for.
Yeah, Ryan, you're absolutely correct, and the reason that we have been able to pay for all of those individuals is because of the COVID relief that has been provided by the federal government. We are using CARES Act funds for the additional staffing that's necessary at the airport. And with the new COVID relief package, we will be able to continue the staffing at the airport. But one of the things we're doing, Ryan, and that's why we are trying to incorporate as many of these options into the Safe Travels program. So, we have software changes in place now so that people can enter their vaccination information, and then it would become part of, your record. For example, I know you had to have created yourself in the Safe Travels system. If you get vaccinated, you can input that information, and then it'll come 14 days after you complete the vaccination regimen, then you would be able to travel within the state. We hope to be able to expand that to Transpacific. So if you travel to the mainland and you have been vaccinated, we can confirm that status. And that's why the Safe Travels programs becomes the heart of the program. As you know, and as you travel back, we really ask for the cooperation and support of the airlines. They are pre-screening those at the departure airport. They're asking to see that all of the information has been entered in the Safe Travels program. And if it has, then it really facilitates and reduces the manpower necessary to screen those people when they arrive. So, we continue to work with our airline and travel partners to streamline the program. We are looking at ways that we can make improvements all the time. And the automation, as you said, for those who are in quarantine, we are texting and calling them to confirm that they are in quarantine. If they don't respond, then we do forward that information to law enforcement so that we could follow up if necessary.
There are a lot of comments that I'm seeing in here, just wary of tourists, saying that tourists aren't wearing masks and worried about visitors complying. I myself was in Waikiki over the weekend, and just walking down the street, I did notice that about a third of the people were not wearing masks. Now, that's not to say they're all visitors, but given that I was in a touristed area, I would assume that many of them were. These folks, they might just be ignorant, for lack of a better word. They might be coming from a place like Florida, for instance, where the mask mandates don't exist. How can we get the messaging better? Because one of the things that we are seeing is this kind of animosity that seems to be growing between the local community and the visitor community. And for us to have a thriving visitor industry, we need to have a better relationship. But, people not wearing masks certainly doesn't help.
We have been working with the hotels and the hospitality industry, Yanji, to really remind people at every step of the process. So with the airports, we're working with the airlines to remind the travelers when they get on the plane that Hawaii does have a mandatory mask mandate. Masks are required indoors as well as outdoors if you can't maintain 6 feet of distance. We're working with the hotels on signage and the messaging systems within the properties to reinforce that masks are mandatory here in the state of Hawaii. And certainly we've been working with the airlines and the hotels to really put up messaging, within their internal systems on flights, having videos that talk about the mask mandate here in the islands. And really, we've been encouraging all of our partners to remind visitors here that we want visitors who are respectful and can acknowledge that we have certain expectations of visitors, that they would be following our mandates and really embracing our precautions to keep our community healthy and safe. And I know that it's not foolproof, and we all remind our partners all the time to reinforce it. But we know that that's part of what we need to do to get back to the new normal, is remind our visitors to be respectful of what we demand of ourselves here in the islands and ask them to put a mask on.
On the topic of hotels and of the hospitality industry, we know that one of the bills that went through the legislature actually restructured the way in which the Hawaii Tourism Authority is funded and the overall responsibility, if you will, of the Hawaii Tourism Authority. Wanted to get your thoughts on that legislation and if it is something that you support.
Yeah, Brian, it's unfortunate that the legislature has really moved that measure. I think it's the wrong proposal at the wrong time. We have pretty much a brand new board at the Hawaii Tourism Authority. I've been looking for members to serve on the board that understand it's about doing a better job of managing the visitors that we bring here. The HTA just embraced a new destination management action plan that they're implementing. It's not about getting more and more tourists. It's about getting tourists who recognize our commitment to environment and health and safety at the same time. And most importantly, it really does, Hawaii Tourism Authority is taking responsibility for recognizing the friction points in every county. Each county has a destination management plan. We've identified the locations where there's friction, like Kailua Beach and others that our residents are expressing concerns about. How HTA is taking that responsibility to bring community and the visitor industry together. We were hopeful to be able to fund some of the solutions that can help visitors and residents coexist in some of these places. And I think most importantly, it really put HTA in the position of being responsible for managing, bringing the communities together, providing resources, and then really implementing an action plan so that we can reduce the friction points between visitors and residents in our communities. It's really hard now if that bill becomes law because, one, we don't have consistent, dedicated funding for HTA, and they're down. They only have funding for 1 year in the current proposal. And it's hard, it's one of those things that we would have to sustain that effort for a long time in order to make the improvements that I think we heard from the community all across the state.
I want to bring in this question, and this is perhaps more suited to someone like Mayor Blangiardi, but it is a question that we get a lot here about why are certain things allowed and why are other things not. Dave Hall says, when will we be able to hold birthday celebrations, graduations? Why only weddings and funerals? And this is something, obviously working with the mayor, you've made allowances to allow certain types of gatherings. When people are trying to figure out what's allowed and what's not and why those things are allowed and not, what do you tell someone like Dave?
Yeah, I think, Dave, one of the things that we look at when we talk about weddings and funerals is there's a very limited number of professional organizations and entities in both of these spaces. And we do have very strict mitigation and guidelines that they are required to implement in order to have weddings and funerals in a safe way. And I think that that's the fundamental difference. Birthday parties in a home, who can we work with in order to identify the things that make a birthday party safer in the home, and who would be willing to implement those actions and enforce it if necessary. I think that's why we've been working with the wedding industry. They have a whole laundry list of things that they are implementing to keep the event safe. Same thing with funerals. It's a little more complicated for private parties in homes and other places where it's not a structured activity.
As we know our time is wrapping up, but we do want to get in as many questions as we can. One of the questions that we saw a lot of in regards to this same vein of what groups are allowed to do what is sports competitions, and a lot of parents asking when there might be an opportunity to be able to watch their kids play sports, especially those who are watching outdoors. We know that allowance has been made, but that parents aren't allowed to gather or to watch. Do you think that there could be any exception made? And again, we know that this is something that the mayor would have to first introduce and you would have to approve. But should that happen, would you allow and would you be in support of allowing parents to be able to watch their kids while maintaining physical distancing?
I mean, I think that that's really the key, Ryan, is that, again, if you get in an unstructured situation, it's really hard to enforce any kind of mitigation activity. And, we struggle with it. I would have loved to travel to see the NCAA finals. I had a lot of conversation with President Lasner about allowing sports fans for the Big West tournament, and I enjoy going to the games, and I know that many in our community would as well. But it came down to, do we take the risk of a super spreader event at this point in time? 4 weeks will make a huge difference in getting more people vaccinated, will make a huge difference in getting back to the new normal. And so I would be reluctant to drop those restrictions, especially because we are seeing on average almost 100 cases every day right now in our community. And those activities can become super spreader events. And it's very difficult to enforce the 6 feet of physical distancing, in a public park with soccer or other kinds of sports activities that are unstructured.
We're getting near the top of the hour, so I just want to give you one last opportunity to perhaps give a message to those who might be vaccine apathetic, if you will. Say, oh, I'll get it eventually, but haven't made the effort to sign up or to make that appointment. What do you say to those folks right now as they try to decide whether or not to get the vaccine?
Well, I just really want to assure everyone that the vaccines are safe and effective. 95% of the healthcare workers who were offered the vaccine took it as quickly as they could. They do know that it's part of getting back to the new normal. We've been working very hard. 90% of our community is now within 5 miles of a vaccination site. We're getting vaccines out, and I certainly want to encourage everyone to get vaccinated. The more and the quicker we get to 75 or 80% of our community vaccinated, the more we get back to normal, so that we can have sporting events and parents can watch their kids again. We can get back to school and not have to worry about school becoming a virus spreader. We can get back to all the things we care about: birthday parties and birthday luau's and picnics at the beach with friends and neighbors, as soon as we can get to that 75 or 80% vaccinated, so that we can stop the spread of COVID-19 in our communities.
Okay, Governor Ige, thank you so much for starting your week out with us and taking our questions and updating us on what's happening with COVID-19 in our community. We appreciate it.
Yeah, aloha. Thank you again, Yanji and Ryan.
Thank you. Aloha. Well, interesting, as always, to hear from the governor there. You did hear that he does not plan to lift the mask mandate anytime soon, despite the CDC recommendation that, you don't necessarily have to wear one outside if you're vaccinated. And his point really was that it's impossible to tell right now who's been vaccinated and who hasn't. And so the way it stands now, if you're 6 feet away from someone and you are outside, you can take your mask off. So he didn't really see the point of introducing a complication to the policy.
And a lot of that attributed to where we're at with just our overall numbers. Continue to say that Hawaii is seeing that consistent number of about 100 cases per day that we see in our daily case count totals. And when pushed upon, well, maybe why the vaccines, with the success the vaccine program has had in Hawaii and the push to get those in Hawaii vaccinated, well, why those numbers kind of remain at the 100 level, it's also because people have become maybe not as careful as they have in the past, and that we're seeing some of these smaller clusters. So I don't, from what he says, we don't expect to see a lot of changes to any of the policies that have been put in place, when comparing it to what we're seeing across the nation in other states where a lot of things continue to change.
That's right. And we also want to give folks who join late an opportunity to know how to follow you this week. You've got some exciting things going on from Ohio. So tell us a little bit about where you are, what you're doing, and how we can get the updates.
Yeah, as the governor said, he would like to be here. Of course, so I'm following the University of Hawaii men's volleyball team. They are competing in the national championship here, going for a national title. They play on Thursday in the national semifinals. This will be the first time that Hawaii will actually be playing in front of some fans. There will be some fans that will be allowed in the arena here in Ohio at the championship. So should be an exciting time. We post daily updates to the Hawaii Athletics sites and all their digital platforms. And so we're updating people on what's happening behind the scenes with the team. I'm in the team bubble. It's very strict, very restrictive with the NCAA. And so there's not a whole lot we're doing other than the hotel and the gym. But it should be an exciting time. And no doubt a lot of people back home are cheering on the team.
Absolutely. And I know that folks will be curious. Tell us a little bit about those COVID protocols.
Well, prior to coming up, everyone within the team bubble that I am in had to get a negative COVID test. We've had to take 4 tests just to get up here. And then we'll also be having to take a test every single day that we are up here to make sure that we are clear. And again, we can't come into contact with anyone else. Food has to be delivered and dropped off. We have to almost just stay together in our bubble the entire time. And yeah, they're very restrictive on what we can and can't do to make sure that all the athletes are safe and all the media and everyone covering it is safe. So it is a very different time that we are in, for sure.
Well, make sure you do follow Ryan and the team. We want to send them all of our support from here in the islands. Normally, there would be a lot of UH fans who would travel up with the team as well. Of course, that's not happening. Shifting gears a little bit, we want to tell you a little bit more about what's in store for the rest of the week. We've got Senator Mazie Hirono joining us on Wednesday. And then on Friday, Todd Bollinger, who is the executive director of Beaky, will be here with us. Beaky has experienced a lot of hardship through the pandemic. That program was really exceeding all expectations before the pandemic, but now they've had to close down stations and they're really in a lot of financial peril. So we'll be talking to him about that.
Yeah, excited for those 2 conversations. Of course, Senator Hirono doing a lot with the Asian discrimination and hate that has been happening. She passed that, helped to pass a very important legislative bill that went through the Senate and the House as well. So we're looking forward to that conversation, and always looking forward to hearing from all of you. Thank you so much for tuning in and being a part of this conversation. Please stay safe. We'll see you right back here on Wednesday for another edition of Spotlight Hawaii. Aloha.